We have a very young patient who has presented to our office today with the chief complaint of a dermatological manifestation of unknown etiology. It's actually pretty big, and it's been present for 5 months. So during the course of the last several months, the patient has been applying an over-the-counter antifungal cream with no signs of relief. That's why the patient is here today. Let's take a look. So, when we look at the diameter, we're looking at several inches by several inches. The patient has seen clear bubbles, gooey, clear bubbles. It definitely itches quite a bit. And when we talk about dermatological manifestations, we're not in the business of assuming. We're in the business of identifying the problem so we can treat the problem accordingly. Just like when people go to the dermatologist and they have biopsies performed to identify either an odd-looking little lesion or mole or anything like that, we do the same. So today we're going to go ahead and perform a punch biopsy. I've always said when in doubt, punch it. It's okay. When in doubt, punch it, because it's really the only way, the for sure way, in respect to the standard of care, identifying a problem. In this case, the dermatological manifestation. So without further ado, just to give everyone, I know people make fun of me when I say without further ado. Those who have or haven't, I'll just go ahead and repeat myself again. These are the devices that we use to perform the little, punch biopsies. They come in different diameters, 2, 3, 4. This is actually a 3. They actually come with a little plunger. I want you guys to take a look at the front. You guys see the little plunger, right? And it locks there. Pressing that unlocks it. The reason why we have this plunger is if the specimen is in there, stuck in there, we're able to pop it right out. Okay? So we've already infiltrated a little bit of lidocaine. And what I usually do, in respect to the anatomy, the foot is very intricate, and there's a lot of tendons, nerves, there's a lot going on, neurovascular structures, and it's just not that simple. Like, for example, the back, where you can, there's a lot of subcutaneous tissue between the skin and, again, the deeper tissues. You have a lot of tendons, this and that, and you have to be, you need to be very, very careful where, doctors punch. We have a nerve that runs right here. We have another 2 tendons here. We have another tendon here. We have ligaments and so on and so forth. So, what I like to do is, I'll ask the patient as I'm performing this, any pain? Any pain?
No.
Any pain?
No.
Okay, good. Any pain?
No.
Okay, good. So once we get down to here, right? I like to do this motion a little bit, and this, and that's it. Sometimes I kind of wiggle it like that, and slowly come out. Okay. And there's a specimen. Okay. So what I'm going to do now is, of course, I don't want to squash. Okay. We open our specimen box. I'll leave it there so you guys can take a quick peek. So I'm gonna put a. Can you see from there, Sebastian? Okay, so that's a perfect. That's a. Oh,
Here it goes.
and there it fell. But you guys can see the dark part is the top part, right? I'll go ahead and cover this. So that's a punch biopsy. That's how we perform these punch biopsies. The area will heal in a couple of days. A little bit of local wound care. You know, the most important and I think the hardest part is, you know, the location of the punch. You don't want to punch the bone. You don't want to punch a tendon. Or like I said before, any neurovascular nerve, artery, anything like that. Because the foot is very, very complex. And I've heard of horror stories where they're actually, you know, that happens. They punch a tendon and all of a sudden, doctor, you know, they come here and they tell me, Dr. Wagner, you know, I had a punch biopsy performed blah, 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 blah a couple months ago and now I can't move my toe. The punch biopsy, this device, okay, the blade on this is extremely sharp. Extremely. So it'll basically just slice through anything. Something else that I wanted to point out, you know, which is kind of, I'm not surprised. The patient and I were talking that she recently went to get a pedicure, right? And I'm scratching my head and I'm thinking to myself, wait a second, let me get this straight. You know, you have this huge patch on the bottom of the foot. And the salon, I guess they went ahead, right?
Yes.
They went ahead and performed the pedicure, knowing that she had this patch, which, you know, was kind of bizarre to me. You know, you see something like this, you would say, wait a second, you may want to see your doctor, or listen, we cannot perform the pedicure because you have this. So, give me 1 second. Sometimes we have to do this. And just like that. Like always, www.jospodiatry.com, Instagram, Dr. Tojan, Joss Podiatry, Facebook, and last but not least, our YouTube channel, Joss Healthcare. I hope everyone enjoys this video. I think that was like the grand finale, you know, like in shows.
So you can like
like on cue. Ready? Laugh.
Now that fade